Just in time.
And there's two more.
Minute warning.
Test, test. Is it working for you? Okay, well, good morning, everyone. It is my true pleasure to be here today to be able to MC this event. My name is Lori Carr, and I'm honored to serve as the Minister of Mental Health and Addictions, Rural and Remote Health, and Seniors. Before we get started, I'd like to recognize a few of my colleagues that are here with us today. Of course, we have Premier Scott Moe here. We have the Minister of Health, the Honourable Jeremy Cockrill. We have the Minister of Advanced Education, the Honourable Ken Cheveldayoff. We also have the Minister of Social Services, the Honourable Terry Jensen, as well as MLA Kevin Weidmark from Moosomin Momart, who also serves as the Legislative Secretary to the Ministers of Health. So thank you all for being here today. I begin by acknowledging that the land on which we gather is Treaty 6 territory, the traditional and ancestral lands of the Plains and Woodland Cree, Saulteaux, Nakota, Dakota, and the home of the Métis. We are gathered here today to announce some groundbreaking initiatives for Saskatchewan's health system. So without further ado, I invite Premier Scott Moe forward to tell us about this exciting announcement for the people of this province.
Thank you very much, Lori, and thank you, everyone, for attending here today on the release of our Patients First healthcare plan. I know many people across the province have been concerned about timely access to healthcare, and it's been much of the discussion that we've had as a government as well. Timely access to a surgery, timely access to that primary healthcare provider. And I'm very excited this morning to talk about improving the outcomes and improving access for Saskatchewan people through our Patients First healthcare plan. There is much information in this document that we have, and I'll get to that in just a few moments, but I want to start by why we are introducing this plan here today. We have listened to people across the province, listened to patients, listened to families, and listened to providers, and I would say this is a government and a healthcare system that continues to listen to you, and we have heard you. While we have had significant gains in the area of creating further access to a healthcare provider and shortening the time for our surgeries, we know there is much work left for us to do, and much of that starts today, or continues today. We have heard from you that many of you do not have access to a primary healthcare provider, and we hear that repeatedly. In some cases, there are those who have simply given up looking for one. And we've listened to you, and we've heard your concerns about having access to a timely surgery. We've listened to healthcare providers. We've heard your concerns about the stresses that are very real in your workplace, your concerns about being able to improve the outcomes, the healthcare outcomes for the patients that we serve. We know that Saskatchewan is not alone in Canada when it comes to the challenges that we face in providing quality and timely health care in this nation. Each and every province across the nation faces a similar challenge. Patients in every province face challenges in accessing a primary health care provider, for example. Patients in each and every province face challenges in accessing timely diagnostic care, and patients in each and every province face challenges in timely referrals to specialists. Patients across Canada face the challenge of the right care in the right place at the right time. And while every province is facing challenges in healthcare, and we all are, we're also facing financial challenges across this nation. Challenges that come from the uncertainty that we're seeing around the globe. Trade disruptions, tariffs, geopolitical uncertainties, reduced revenues due to the trade issues that we are facing, whether they be direct or indirect. And as you saw just recently, we saw a provincial budget released in British Columbia that had about a $13 billion deficit. We saw close to 10 or just over $9 billion in our neighboring province of Alberta. And in Saskatchewan, I would say that we are facing very similar revenue challenges as well. So as we as a government come together to make difficult decisions this year, what we will not do is jeopardize the gains that we've made in delivering health care to the people that we serve in this province. We'll protect Saskatchewan patients by continuing to invest in our healthcare system. We'll improve access across the province, and access to primary care providers, access to those timely surgeries and diagnostics. We'll improve outcomes and always focus on putting patients first. And we'll look for opportunities through innovation, recruitment and retention efforts, capital investments, and working with our healthcare providers across Saskatchewan. The plan that I'm here to speak about today comes from that very listening to patients and families in this province, listening to healthcare providers and listening to all that we have had the opportunity to talk to. And what we've heard are really reflected in the two commitments in the 2024 speech from the throne following the election. Access to primary health care providers for everyone in Saskatchewan was a commitment that we made. And access to timely surgeries and diagnostics, also a commitment that we made. These two commitments were also the motivation behind the Health Human Resource Plan that we announced in 2022. And the gains that have been made in the last few years are encouraging, and I would say in some instances in this province quite remarkable. But again, I would say that we very much understand that there's more that needs to be done. So when it comes to accessing a timely diagnostic or a timely surgery, and Minister Cockrill will have a little bit more to add on this as well, but we have set targets. The target of 450,000 surgeries over the course of 4 years. And year one of that, we're well over 100,000 surgeries. It was a record number for the number of surgeries that have been performed in this province, and we're on track to achieve that 450,000 surgeries in 4 years. We are also setting targets here today to have a 3-month wait time for those surgeries by 2028. To have 90% of our patients that are waiting for a diagnostic are going to have that diagnostic in 60 days or less. Those are targets that we put out today. And there's efforts and initiatives of what we will discuss here today and opening up the conversation for the days ahead to ensure that we are able to achieve those targets, put our patients first, and improve the outcomes that everyone has when they use our healthcare system. So we're hiring surgeons across the province, and you'll hear us talk about the in excess of 1,000 physicians that have been hired in Saskatchewan. Our surgeons over the last 5 years, our surgeon numbers are up 103%. There's more work to do in this space as well. We're hiring nurses. About 3,000 nurses have been hired in the last 2 years. We're increasing our acute care bed capacity in this province significantly, with over 200 beds over the last 5 years that have been added to hospitals in Saskatoon and Regina, adding another 142 beds as we speak. 57 more beds will be added to the Prince Albert Hospital on its completion. All told, about 400 additional acute care beds to support our surgical initiatives and to support health care for Saskatchewan residents. Since 2010, we have performed 184,000 publicly funded, privately delivered surgeries in this province. This past year was 17,000 publicly funded, privately delivered surgeries in this province. And so we're going to continue to expand the numbers in that space, those publicly funded, privately delivered surgeries. And we're looking at how we can utilize this system to expand some of the very high volume surgeries that we have that are low complexity and provide the opportunity for third-party deliveries to offer those surgeries. We have more surgeons, and we need more surgeons in order to achieve our goal of 450,000 surgeries over 4 years, having everyone be able to access a surgery in 3 months, and to have 90% of residents achieve their diagnostic within 60 days. We need more surgeons. We need more healthcare professionals as a whole, which I spoke to. and we need to have more provincial surgical capacity that's publicly funded and privately delivered. We need more acute care hospital beds to support those surgeries that are happening. And we will utilize all of the tools that we have available to us to continue to protect our healthcare system in this province, and we will continue to invest in improving those very healthcare outcomes on behalf of the residents that we serve. Equally important, I would say, to all of those aforementioned items when it comes to a timely surgery and a timely diagnostic is to have a timely referral from your primary healthcare provider, which is why we committed to attach each and every resident in this province to a primary healthcare provider. And that isn't the case across Canada today. It certainly isn't the case in Saskatchewan today, but that is the target and that is where we are heading in this province. This effort to create access to a primary healthcare provider is evident in the very facility that we are today. The outbuild of our urgent care centers, and I want to thank Jay Hennique for coming. It was Jay's uncle Ray Hennique that very much was an instigator in the third-party partnership that we have with the Takakoop Cree Nation on building this facility in Saskatoon today, and we miss Ray dearly. This urgent care center here in Saskatoon will be the first of two in this city. This follows the first one, which is up and operational and has been operational since 2024 in Regina, and we see that on Albert Street, and we were there at the opening. Daily volumes at that Regina Urgent Care Center are not quite, but starting to rival, in the 16 hours a day that it's open, starting to rival some of the capacity that we're seeing in our emergency rooms at the Pasqua and the General. 65,000 Saskatchewan patients have been seen at that Regina Urgent Care Center, and very shortly we are going to see those kind of numbers coming through the front doors of this facility as well. Then we're going to go on, as I said, to build another one in this city, another one in Regina, one in Prince Albert, Moose Jaw, as well as the Battlefords. This will help us, not only in alleviating some of our emergency care pressures that we see in our large centers and across the province, but it's also going to help us create that opportunity for people to be able to have access to a primary health care provider, whether it's a nurse practitioner, whether it's a physician assistant. We're looking at how can we optimize the scope of every healthcare professional that's working in our healthcare system. So we're looking at how to expand and optimize scope for all healthcare professionals, so that all healthcare professionals can utilize all of the tools that they were trained to utilize to offer care by working to the very full scope of their potential. To align those scope of services then with the best practices and the national standards across Canada. And so scope optimization certainly is going to have an opportunity for us to improve the outcomes within our healthcare system, give our healthcare workers the tools that they are trained to utilize to offer that patient's first level of care that Saskatchewan residents are looking for, and I would say expect. So as we expand our acute care capacity, expanding our emergency rooms, which is happening, we are expanding our mental health and addictions care, which again is evident with this facility right here today, expanding our urgent care center outbuild. We need to, like every other province, have qualified people that are offering those services in that infrastructure. Infrastructure is but the first step of offering health care. That's why we had came forward with what I would say is the most ambitious health human resource plan in the nation. And that health human resource plan is showing results with over 900 training seats that have been opened up in our post-secondary institutes across the province, whether it's RNs, whether it's LPNs, CCAs. There are over 900 training spots that have been opened up, and we're delivering on our commitment to open up the access to training healthcare professionals in this province. And Ken Cheveldayoff, our Minister of Advanced Education, has been very closely working with our post-secondary institutes to ensure that that is the case. It's resulted in over 1,400 physicians, as I said, coming in and offering services in our healthcare system. About 3,000 nurses have been hired by the Saskatchewan Health Authority and are offering services in our healthcare system. We are going to go a number of steps further when it comes to primary healthcare providers and training more primary healthcare providers in this province. As you know, and I know all well, as I was involved as a volunteer in recruiting healthcare professionals prior to when I was elected in 2011. But in 2007, when we formed government, there was 60 College of Medicine training seats here in Saskatoon. We'd expanded that to 100, then to 108. We're now going to expand it a further 20 seats with very much a focus on Saskatchewan residents and very much a focus on a return for service and keeping those graduates right here in the province, of which I would say the Saskatchewan Health Authority, the College of Medicine, and all of those involved are doing a remarkable job of today, but we're not going to let off our efforts in that space in any way, shape, or form. Second to that, going back to 2007, there were 60 residency seats that were available here in the province of Saskatchewan. We have expanded that greatly to 120 in 2008 or 9, if I believe, and have continued to expand that, where today we're at 150, 151?
61.
Is that with the 10 that we're doing today? So we're 151, now we're at 161 as we expand that another 10 seats here today, again with a focus on keeping our primary healthcare providers in the province. In addition to that, when it comes to nurse practitioners and the valuable service that they offer, often to rural and remote communities, but I would say to all Saskatchewan residents, we're going to increase our training seats for nurse practitioners here in Saskatchewan by 45%. Our Health Human Resource Action Plan, our expansion of training seats now, which is nearing 1,000 training seats in the province, is showing results as the Government of Canada Job Bank states, and I quote, "Recent labour market highlights in this healthcare sector include remarkable results from the province of Saskatchewan's Health Human Resource Action Plan." And so we're going to continue to do what is working in increasing the number of healthcare workers in our offering healthcare services across Saskatchewan. And we're going to continue to give our healthcare workers the tools so they can offer that improved outcome and that patient's first level of care. Virtual care. And I want to say thank you to the Dakota Whitecap Cree Nation for their initiatives into the virtual care space. Dr. Menendez was involved, and many others, healthcare providers, have been involved in that initiative as well. That initiative today is serving 29 rural and northern communities, serving them very, very well with virtual healthcare services. So we want to continue our expansion and building on positives within our healthcare system, bringing in today's innovation that wasn't available just even a few years ago, to provide that support and those tools for our healthcare workers to be able to offer that right care in the right time at the right place. And so we are going to open up virtual care in a much more significant way than we have even seen till today. We're going to introduce web-based virtual care to any Saskatchewan resident, focusing on those residents that today are unattached to a primary health care provider. I said earlier, our commitment is to have everyone attached to a primary health care provider, and virtual care is going to allow us to take great strides in that space as we open it up to web-based virtual care across the province, continuing to work with initiatives that are in place like the Dakota Whitecap Virtual Healthcare Hub. Early implementation of virtual care is going to be about preparing for the expansion across the province. We will focus in certain areas of the province on those unattached patients and then start to expand the access to that virtual care across the province. This is going to open up new opportunities for Saskatchewan families and ultimately Saskatchewan patients, and I would say even healthcare workers, to see a primary healthcare provider when they need it, and certainly take great strides in this province at providing that right care at the right place at the right time. Over the years, we have seen various recruiting agencies in this province, and I think back to the days of the Physician Recruitment Agency of Saskatchewan, moved on to the Sask Docs, and today we see the Sask Health Recruitment Agency, or the SHRA. We also see a Saskatchewan Health Authority. That very much is a large organization that has expanded into many, many areas of ensuring that we are offering that high-class health care that Saskatchewan people expect. We have tools now available with the recruitment agency, the Saskatchewan Healthcare Recruitment Agency, to expand the mandate of that organization to assist and support in the hiring and recruiting of healthcare professionals in this province. I think back to the days of Sask Docs and the Physician Recruitment Agency of Saskatchewan. Those were brought in because we had a shortage of doctors across this province. Today, the Saskatchewan Health Recruitment Agency is about much more than doctors. It's about finding the right healthcare professional and finding the right position for them in a community in this province. The Saskatchewan Healthcare Recruitment Agency also in a much more ambitious way, is able to work with those local communities, overlaying local incentives and local recruitment incentives that are present with the provincial incentives, and bringing people right to the door of the Saskatchewan Health Authority to ensure that they are going to have a rewarding career offering healthcare services in the province. So the next steps in this space, and I would say these are very logical steps, is to expand the mandate of the Saskatchewan Health Recruitment Agency. Expand the mandate so they will take care of all of the recruitment in the province and outside of the province for healthcare workers that are coming and interested in working at the Saskatchewan Health Authority. What we'll ask the Saskatchewan Health Authority to do in a very transparent way is to post the jobs that are available in the community and at the health facility that particular career is available at, and then ask the Saskatchewan Health Recruitment Agency, alongside working with associations, working with local community efforts, to bring people to those positions wherever they might be and whatever discipline that might be in the province. So really what we're going to do in this space is we are going to work together. In a very transparent way, the Saskatchewan Health Authority will provide the careers that are available in the community at the facility, and then the Saskatchewan Healthcare Recruitment Agency, supported by the community, supported by associations, supported by the government of Saskatchewan, are going to do all that we can to ensure that those positions are filled in community after community after community across this province, so that those healthcare professionals not only have the tools to deliver that patient's first level of healthcare, but those healthcare professionals are actually able to have a career in a Saskatchewan community, and we invite them to do so. And just a closing note on our healthcare workers. We want our healthcare providers to have a quality work environment so that they can improve outcomes for their patients. And I want to thank each and every one of our healthcare workers across this province, past and present, our registered nurses, our physicians, our licensed practical nurses, our continuing care assistants, diagnostic technicians, paramedics, the whole works of our professional healthcare staff. I know you are facing challenges each and every day that you arrive at work. We have listened to you and we have heard your concerns. And we know that by supporting you and by improving your workplace, that you are going to then be able to improve the healthcare outcomes for your patients. We've also heard from the people of Saskatchewan. We've heard from patients. We've heard from families with loved ones that are in and utilizing the healthcare system. Many of us have been there, virtually all of us at some point. And throughout the implementation of this Patients First plan, we are going to continue to listen. And so this is the start of the conversation. But I would say that this plan that we're putting forward today is comprehensive. It has the patient's concern and the patient care at the very core of every one of these initiatives and every one of the decisions that has yet to be made. We will improve outcomes in this province by improving access to a healthcare provider, improving access to timely surgeries and diagnostics, and putting patients first each and every day. Thank you very much, everyone.
Well, thank you very much for that, Mr. Premier. And now I would like to ask my colleague, the Minister of Health, Jeremy Cockrill, to tell us a bit more. Now, I'm not sure how much of his speech is left after the Premier was done here, but he might have a little bit more to add.
Morning, everyone, and thanks for being here in Saskatoon. And, you know, I think it's not only important that we're here in Saskatoon today, but really just the building that we're in today. I think, as the Premier indicated, really represents, I think, where we're going with healthcare in Saskatchewan. And thank you, Premier, for your comments this morning and your commitment to a patients-first healthcare system. And today is really about patients in Saskatchewan. Healthcare isn't just a system, it's people who need care, and it's about the people who provide it as well. And across Saskatchewan, patients have told us that they want improved access to primary care, faster access to diagnostics, and reduced wait times for necessary surgeries. And so I want to say this very clearly to families and patients. We've heard you, and standing still is no longer an option. And that's why today we have released the Patients First Healthcare Plan. And the plan is grounded in one clear commitment: patients must be at the center of every single decision that we make. Now, this is not a declaration that every challenge in the healthcare system has been solved today or will be solved next week or solved next month, but it is a commitment to accelerate the change that is already underway in our healthcare system, to improve access, to modernize care, and to strengthen the system so that Saskatchewan people receive the right care in the right place and at the right time. The plan really builds on two clear commitments that the Premier mentioned, and he mentioned them, that they come from the 2024 throne speech. First, connecting every Saskatchewan resident to a primary care provider, and secondly, ensuring patients can access surgery in a timely manner and as close to home as possible. Everything in this plan is organized around these two targets and these two outcomes that are so important to patients. So let me start with primary care access, because this is where patients have told us the pressure in the healthcare system is often felt first. It's vitally important that everyone in the province has access to a primary care provider. And that's why, as part of this plan, we are taking an all-in approach on the role of nurse practitioners in this province as a central part of improving that access to primary care. Nurse practitioners are trusted professionals with advanced training. They assess, diagnose, treat, prescribe, and manage both routine and complex care. And patients around the province consistently tell us they value the relationship-based care that nurse practitioners offer. Now, over the last year, Saskatchewan has launched the largest publicly funded nurse practitioner primary care expansion in the history of this province. We've introduced a new funding model that allows nurse practitioners to deliver publicly funded care through independent contracts. And as part of this plan, we're announcing that there's no more limit on the number of those contracts around the province. As part of those contracts, we're going to allow nurse practitioners to hire LPNs, RNs, other allied staffs to build out the team-based care that many of our physicians are working in around the province, but we also want nurse practitioners to lead those efforts as well. And I'd like to just thank especially the Saskatchewan Association of Nurse Practitioners. The president, Tony Giraudier, is here today. And I'll just say, Tony, the collaboration with you and your organization over the last year has been really helpful in terms of getting us to a place where we can really focus on the role of nurse practitioners and what that means for patients. But I want to say this is a very important piece. This approach doesn't work in competition with physicians. It actually complements the work of family physicians right around the province. It can strengthen the team-based care so that patients can access the right provider and sooner. This is what Patients First looks like in practice. More doors open, less reliance on emergency rooms, and care that is consistent and, again, as close to home as possible. Now, the plan today also reflects real progress already underway in hospitals, diagnostics, and the surgical parts of our system. As the Premier mentioned, we've increased acute care and ICU bed capacity in the province, most notably recently through our large Saskatoon City Hospital project, where we're adding 109 acute care beds in that facility. As part of this plan that we're releasing today, we're announcing 36 new acute care beds here in Saskatoon at Royal University Hospital that will be open later this year, as well as a 3-bed expansion to the neonatal intensive care unit at Regina General Hospital. We've increased diagnostic capacity by more than 55,000 CT scans and 15,000 MRI scans per year since 2020, and launched a mobile MRI unit, enhanced PET CT services, and we're very excited to have the new MRI machine in Estevan going live to serve patients in July. As the Premier mentioned, last year alone, we completed over 100,000 surgeries in this province, a new record in Saskatchewan. There's more work to do and there's more surgeries to do. But part of the surgical plan that's really exciting is the addition of robot-assisted surgeries over the last couple of years. We're seeing that in both Saskatoon and Regina, and we're going to see continued investment in that space in years going forward. Now, we all know, especially for those of you that work in the healthcare system, none of this actually happens without people providing the care. And that's why the Health Human Resources Action Plan laid the foundation for this work, and this plan is building on that foundation. Good progress has already been made, as the Premier mentioned, but we have to stay focused on what's ahead and continue to keep being ambitious. I'm really excited. This plan commits to major new training expansions, 26 new nurse practitioner training seats, increasing NP training capacity in this province by 45%. I see Selena Richter here, the Dean of the College of Medicine at the U of S. 13 seats will be added to the University of Saskatchewan's College of Nursing, and 13 seats added to the U of R SAS Poly program. We're very excited for the work already being done in these programs and what's going to happen going forward. And as a note here, as part of this plan, which I believe really needs mentioning, because this is something we hear from communities all across the province, is how do we attract nurse practitioners to our communities? And we know that for many RNs considering the jump up to being a nurse practitioner, oftentimes there's a financial barrier. And as part of this plan, we'll be introducing a $78,000 financial incentive with a return of service contract to attract more registered nurses to become nurse practitioners and consider that career path. This is really exciting stuff, both for the nurse practitioner community around the province, but also for communities seeking to add primary care providers in their own communities. As the Premier mentioned, we've been working closely with Dr. Sarah Forgy, the Dean of the College of Medicine. We so appreciate the partnership that we have with Dr. Forgy. She does incredible work and her team at the College of Medicine. So going from 108 to 128 undergraduate seats at the College of Medicine, you know, the Premier talked about some of the financial pressures that provinces are experiencing right around the country. And in a year where there's financial pressures on every single provincial government, I would challenge folks to find another province that's increasing NP training capacity by 45%, that's increasing physician training capacity by nearly 20%. This is how we are going to continue to lead the way in developing our health human resources workforce. Now, on the College of Medicine note, we're also going to be asking the College of Medicine to ensure that 95% of those undergraduate students are Saskatchewan residents. This is something that we hear from patients regularly, that they want to know that their community members, their children, their grandchildren have the best possible opportunity to study medicine in this province and become those family physicians and specialists that will serve all of us for years going ahead. And in all training programs, and this goes for both nurse practitioners, nurses, physicians, but all allied healthcare professionals as well. This plan continues to set us on a path to ensure that our educational and training pathways are distributed around the province as much as possible, so that you don't need to only come to Saskatoon or Regina for training. It's important that people have training opportunities as close to home as possible right across the province, whether you live in Regina, Saskatoon, a rural community, or a northern community. It's incredibly important. Now, putting patients first also means making it easier to find the right door for care. And too many people with urgent but non-emergency needs have felt they've had no other option but to go to the emergency room. And our emergency room nurses and doctors are feeling that pressure. That's why we're expanding urgent care centers and virtual supports. Premier already talked about the success that we've seen with the Regina Urgent Care Center. We look forward to this facility opening next year, and we're going to have more to say about what the urgent care models will look like in Moose Jaw, Prince Albert, and North Battleford very soon. Premier also mentioned the virtual care supports that will be offered to all Saskatchewan residents eventually, but focusing initially on unattached patients. This is incredibly important because it's going to allow unattached patients to receive or renew prescriptions and receive basic primary care in the comfort of their home, whereas many of these patients are currently accessing emergency rooms to receive this type of care. I'll also mention that, we've talked about patients, we've talked about providers. We've talked about our educational institutions as well. Another very important partner in how we deliver healthcare is our municipalities and our communities. We've had significant capital investments being made over the last several years, right across Saskatchewan in communities large and small. And up to this point, communities have been responsible for 20% of capital costs in furnishing fixtures and equipment. Today, as this part of this plan, we're announcing a reduction of that community share to 10%. Easing the burden on communities and taxpayers right around the province while still delivering high-quality healthcare capital projects. Mayor Dennis Helmuth from Rostern is here today, and we've appreciated Dennis's partnership over the last several years as we work towards a new hospital in Rostern and look forward to delivering that project and many other projects going forward, but doing so at a lesser burden to communities and taxpayers is incredibly important. But in closing, I just want to return to what this plan is really all about. When you're a patient, you don't care about bureaucracy, you don't care about strategies, and frankly, you don't really care about politics. What matters most is getting the care that you need from someone you trust when you need it and as close to home as possible. Now, improving healthcare requires some pretty honest assessment, collaboration, and sometimes change that feels uncomfortable at first. But the more we listen to patients and families and providers across the province, the more convinced that I become, the more convinced the Premier is that putting patients first is the right path forward. So thank you, everybody, for being here today. Thank you for your partnership in improving healthcare and putting patients first, and we look forward to continuing to work together.
Well, thank you, everyone, for taking the time to be here today. And I often know in my role, people ask me, how am I enjoying my portfolio? And, I often tell them it's very challenging, but it's days like today when we're working with people from all stripes to make decisions that truly is going to make healthcare better for the province of Saskatchewan and the residents and the patients who will be put first. So I'm really excited about this announcement today. So thank you once again for being here. We're just gonna gather for a photo first, and then we will take some questions from the media. So thank you all for coming. Yeah, the MLAs. Come on up. Do you want to just stand in front of this?
Oh, stand.
We can move this over.
Put a couple on that side.
Alright, everyone in the middle here, big smile.
Okay, great. We'll open it up for questions for whoever you want. Mr. Cockrill, Premier.
Good.
Thank you so much.
Any questions? It was pretty comprehensive opening comments.
Yeah, you've got about 30 pages of information here, but not a lot of dollar figures. How much is this going to cost? And is it going to be all new? I mean, I'm assuming we're going to find out more budget. Is it going to be reallocating existing resources, or is it going to be a lot of new money?
All of that. As you know, for instance, let's use the example of our urgent care centers and continuing with the outbuild of those facilities that I think are having a very high impact on improving outcomes and access to a primary health care provider, providing urgent care that may not necessarily be urgent, and it's providing some relief to our emergency rooms as well. That's a commitment that has been made. Obviously, with this particular facility, much of the expense has already been undertaken. With respect to the expansion at the College of Medicine, and other post-secondary institutes on expanding the physician seats, the nurse practitioner seats. You'll see that funding arrive as it's needed and as we're able to expand those particular seats. And so you'll see a more fulsome snapshot at this budget and I think future budgets. But what you have here today is the commitments on a patient's first healthcare plan that is going to improve access and improve outcomes for Saskatchewan residents.
You
mentioned urgent care centers. I mean, just this weekend you had to reduce the hours at the urgent care center in Regina, which has been a kind of chronic problem there. Why is this a good model going forward, and what have you learned from the experience in Regina?
We have to, double down our efforts on the Health Human Resource Action Plan that we have. You're seeing that with investments in training. Like, we've identified that, not only have we had some staffing shortages at the urgent care center, but it's fair to say across Canada there's been staffing shortages in healthcare facility after healthcare facility. In Saskatchewan, we had come forward in 2022 with our healthcare human resource plan, have put in place now the expansion of over 900 training seats, adding to that today. An incentive today, I think, a very realistic, and I think will be have a high degree of outcomes on individuals that may choose this path is the $87,000 incentive, $78,000. I just almost increased it there. For RNs to take a period of training and become a nurse practitioner. And that's something we heard very directly through our discussions, the health ministers, other MLAs with RNs across the province, that they would like to take the training to become a nurse practitioner. However, there's a break in your income. You have to go do this particular training, and we're trying to support that with a return for service, so that individual has the opportunity to offer services in Saskatchewan as a nurse practitioner. So I would say the challenge isn't in any way restricted or chronic in that way to the urgent care center in Regina. It's across the province and across Canada, and which I think speaks to the importance of coming forward with this plan here today, which is the opening of a conversation, which is going to continue with initiatives as we move forward that make sense, put patients first, improve the outcomes in our healthcare system, support those that are offering those healthcare services in our system, to be very open about bringing in today's innovation that's available that wasn't available even just a few years ago. And nurse practitioners is a testament to that. It isn't that long ago that nurse practitioners were, very low numbers in our healthcare system, if existent at all. I would say today in many communities, they very much are a primary deliverer of healthcare in community after community, and likely going to be in a more significant role in the years ahead. And so that's an example of the health human resource in action, and some of the opportunities that we have with the disciplines, the innovation that's available today, ensuring that we're embedding that into the conversation about how we deliver healthcare day in, day out.
Yeah, and I'll just say, as Premier said, that, the staffing challenges, they exist, and we're continuing to work on that. But your question was really about the model of urgent care. And I think the model of urgent care is incredibly important because it really ensures that the patients are accessing the right level of care for their particular need at the time. And we think about what we've done with other disciplines. I think about the pharmacist scope expansion specifically, being able to test for strep throat and ear infections. If my toddler has an ear infection, I don't want to go to the emergency room. I don't want to sit at the emergency room for hours with a 3-year-old that isn't happy. That's not fun for anybody. So this is where, providing more doors for people to access that care, whether that's in a pharmacy, whether that's in an urgent care center to move people through quicker, the model is the right model. Obviously, continuing to work on the staffing and making sure that that's stable, both in Regina and Saskatoon and the 3 other communities, is going to be incredibly important. But the model is what matters most to patients.
So when you look at this facility, for example, do you think you've learned lessons? Do you think that this plan that you have will, alleviate some of the issues you had in Regina by the time this one opens? And if you want to tell me when you think it's going to open.
Yeah, so this facility that we're in right now, we're all kind of in the waiting room right now, actually. So it will be open in 2027. We're working to accelerate that as quickly as possible. Right now, fall 2027 open for patients, but we're working with our construction partners to move as quickly as we can. From a staffing perspective, lessons have absolutely been learned. When we opened the Regina Urgent Care Center, and I've talked about this before, it was primarily going to be staffed by emergency room physicians. I think what we've figured out over time is actually there's a real important role that other professionals can play. Family physicians, nurse practitioners, other allied health professionals. Again, just because you go to an emergency room or an urgent care center doesn't necessarily mean you need to see a doctor if there's an NP that could meet your needs as well, or another professional. That's what this is all about in terms of getting the models of care right so that we can get the right care at the right place and the right time.
A lot of this rests on
nurse practitioners, as you mentioned, these models. Is that something a lot of people in Saskatchewan are just going to maybe have to get used to, that their primary care provider will be a nurse practitioner as opposed to a doctor moving forward?
I think people are already there, quite frankly. You know, I know the Premier, I'll let the Premier speak for his own healthcare, but I know the Premier sees a nurse practitioner himself, as do many residents right across the province. We hear, I haven't met a Saskatchewan resident who didn't like their care from a nurse practitioner. Not to say that it doesn't exist out there, but I would say by and large, Saskatchewan residents who are seen by nurse practitioners are very happy with the level of care that they receive. You know, and I think it's important to note, you know, as I mentioned in my comments, this isn't a competition, right? We're adding more nurse practitioner seats. We're adding more family physician seats. As part of the 10 residency seats that we've added this year, 5 of those are in rural communities. You know, Melfort, Nipawin, Yorkton, ensuring that we can be training more family physicians in communities like that and adding opportunities for nurse practitioners to have those independent contracts, open up their primary care clinic. You know, we're going to head to SARM this week in Regina. And I can tell you, you know, rural communities right across the province, I don't want to speak for all of my colleagues, but the feedback on nurse practitioners is incredibly positive. And if you haven't been able to receive care from one, I would invite you to look for an opportunity, because I think they provide a really high quality of care for Saskatchewan residents.
In terms of timeline, how long until residents start noticing a difference in their healthcare?
Well, I think it's important to note, and maybe the Premier has some thoughts on this as well, but we're already starting to see some positive impacts. We think about the 23 nurse practitioner contracts that have already been signed. That's attaching 18,000 patients to a primary care provider that didn't have a primary care provider last year. We're going to be signing more of those contracts in the coming months with nurse practitioners. You know, exciting to see our residency seats come to fruition, starting to graduate more residents, keep more of those graduating residents right here in Saskatchewan. Some of these things are going to they have a longer tail on them, a longer runway. But I would say already in certain communities, people are starting to notice a difference, and that will become more evident in the coming months as well. Again, as we graduate healthcare professionals and get them working in communities.
I just, first comment on that egregious violation of HIPAA. I just say, you know, I think how long until Saskatchewan people notice? I think we're starting to notice the results of some of these investments today. We see the incorporation of larger numbers of nurse practitioners in our healthcare system offering that patient's first level of care today. We see the urgent care center operating in Regina as we speak. But now we're going to see some longer term, I guess there's a number of other things that you'll see quite immediate. The expansion of virtual care, building on the success of the Dakota Whitecap virtual care model. You'll see that, I think, in a shorter period of time. But for instance, the training and the expansion of the medical seats at the College of Medicine, that will take a couple of years. You'll see the residency seats sooner than that. But it's about continuously improving the healthcare system and putting in place, by listening to people and patients across this province, putting in place and building on the initiatives that are working and that make sense in elevating people's access to primary healthcare providers, elevating their opportunity for a shorter wait time for a surgery and for a diagnostic. And so some of the results are here today. Some you will see in a short period of time, and some will have a longer timeline, and we're going to keep adding to that as we continue to converse and to listen with healthcare workers, with patients and families across this province. To the earlier question about being a nurse practitioner focused or centric, nurse practitioners are very much at the center of our healthcare system in this province. But I think when you look at the suite of announcements, whether it's virtual care, whether it's the expansion of physician training seats, the expansion of medicine seats, the expansion of the nurse practitioner seats, all of those together, really, this is an all of the above approach. It's not focused on any one discipline. The scope optimization across all disciplines in the healthcare system, so that our each and every healthcare person offering healthcare services is able to work at the level that they were trained to work at. It really is a very encompassing initiative and very encompassing efforts that are focused on the patient, I would say, as opposed to any one aspect of the healthcare system, and focused on providing that right level of care at the right time in the right place in the province.
What about recruitment? What about retention for those currently working in the system? What is new for that?
Yeah, I'll make a comment to that. I think, when I speak with healthcare professionals right across the province, I think it's important, from a retention perspective, it's important to fill the vacancies that we do have. That is a significant help when it comes to retention and, reducing dependence on overtime, reducing dependence on contract staff. Again, when it comes to retention, we have ongoing discussions at all of our bargaining tables with all of our union partners. I'm confident that we'll get to a good spot with all of our union partners on the various bargaining tables that we have open right now. But again, I think so much of what we're talking about today when it comes to recruitment, oftentimes those ideas are viewed as two separate ideas. I think it really is about building the overall brand and narrative of what a career in healthcare in Saskatchewan looks like, and that this is a great place to practice clinically, and it's also a great place to live. And I think allowing the healthcare recruitment agency to have more oversight, I would say, over that whole spectrum of delivering high-quality external candidates, whether they're in province or whether they're from out of province, delivering those to the SHA so that the SHA can add them in communities, and as well as our affiliate partners right across the province as well. I think that is that'll make the biggest difference for retention in the long term. It's going to take time, but that is what will make the biggest difference.
Can you speak more about what surgeries are going to be publicly funded, privately performed? Are there certain types of surgeries that fall under that?
Yeah, I'd say so. We have surgical community partners right now, those third-party providers, both in Saskatoon and Regina. A significant number of cataract surgeries in the province are done. Continuing to go down that way. The Premier made a good comment about lower complexity but higher volume surgeries. Cataract surgeries fit the bill. That's the largest number of surgeries that we do in the province each and every single year. We're going to continue to look for more opportunities. Again, I think to get those surgeries out of the hospital, free up our hospital operating rooms for more complex surgeries that maybe take longer, require a longer recovery time. We have our community partners getting into more orthopedic surgeries. We're looking to expand what they're able to do there in terms of keeping patients overnight for recovery time and so on. Again, we have a very high quality surgical partner and looking to add more of that to this province as well, and not just on the surgical side. And we talked about the diagnostic side as well. I think there's incredible opportunity that we're just starting at the cusp of, and the Premier talked about how the plan today is really the start of many conversations. I think there's incredible opportunity for third-party diagnostics and increasing that number of delivery right across the province, not only in Regina and Saskatoon, but seeing how we could do that in smaller communities as well.
For this plan, particularly with patients, can you go a bit more into what the consultation process looked like that contributed to creating this plan?
Yeah, I'll just say, Minister Carr and I, and the Premier as well, we have the opportunity to meet with healthcare stakeholders right across the sector. So whether that's our healthcare providers, whether that's folks like our educational institutions as well. But I would just say as MLAs, you have a unique job where you're face-to-face with patients each and every single day, whether it's in your constituency office, in my case in North Battleford, or even the grocery store. And let's face it, all of us are touched by healthcare at some point in our lives. Even if it's not personally, it might be a family member. And I can tell you, as an MLA, you hear those stories right across the province. And I would say that consultation, hearing stories from people, hearing feedback from patients right across the province about wanting better access, asking why can't certain professionals do certain things. It's that type of feedback that's really led to where we are today with this Patients First healthcare plan, and I think where we're going to go in the future.
When it comes to expanding the scope of these healthcare providers' practices, what advice have you taken on that, and who is that advice from?
Yeah, so I would say the scope conversation is two levels. Number one is really around scope optimization. And let's face it, the Saskatchewan Health Authority is a combination of a whole bunch of former regional health authorities that all had somewhat varying policies in terms of what certain professions can do. So the Saskatchewan Health Authority has some work internally to do in making sure that what a licensed practical nurse can do in this community, they can also do in this community, and making sure that is optimized to the highest possible level across the entire system. The second step is really around scope expansion. And when we talk to, there's a number of professionals that we're looking to expand scope with, dietitians, optometrists, potentially chiropractors, nurses. So we're going to have conversations with all of those regulatory bodies. Some of those conversations, quite frankly, have already been happening, I would say at an accelerated path over the last several months and the year. So we look forward to, I would say, introducing some fairly ambitious legislation in the fall session around on the scope, the second piece, which is the scope expansion piece, and ensuring that everybody in Saskatchewan that's already in our healthcare system and those that we're going to be recruiting and bringing into our healthcare system can work to the highest possible scope right across Canada, right here in Saskatchewan.
And for clarification, looking at staffing issues at Regina's UCC, do you folks plan on expanding that to 24 hours before you open this center and others?
No, we've been quite clear already that the plan is not to go to 24 hours with the urgent care centers. And again, that decision is not made on a whim. That decision is looking at the data, at the volume of patients that we see at the Regina General and Regina Pasqua overnight. Why would we staff a third facility in Regina when we can handle the volume that exists overnight at those two facilities? Doesn't mean there aren't pressures, but that's going to be our priority. Obviously, as we get started here at 16 hours a day in Saskatoon, we'll evaluate how this urgent care center releases stress on St. Paul's emergency room and the two other emergency rooms in Saskatoon and make a determination from there. But at this point, I'm comfortable with the 16-hour staffing model, and we'll continue working on that.
Yeah, thank you. And, we know emergency rooms have closed in rural Saskatchewan. When can healthcare workers out there expect to see changes from this plan?
Well, I would say they're already, I would say they're already seeing relief to those temporary disruptions. I mean, the virtual physician program that exists already, it serves nearly 30 facilities. I think it believes serves 30 facilities as of this week, with Assiniboia now being added to the virtual physician program. The virtual physician program has avoided over 5,000 temporary disruptions in emergency rooms in rural Saskatchewan. That is significant in terms of ensuring that people can access those acute care services as close to home as possible. I think where you're going to see more acceleration due to this plan is really the role that nurse practitioners could play in emergency rooms, nurse practitioners with enhanced training to ensure that they could handle acute care settings that already exists in several facilities right across the province, but we'll be looking at that. And then we're also looking at ways to expand the pool of virtual physicians, again, making that virtual physician program available to more facilities and making sure that those temporary disruptions can be totally avoided.
A couple of economic questions for you. It's about the trip to India, and I wanted to ask you first what you would say was accomplished for Saskatchewan during that trip.
$3 billion of uranium sales over the next 9 years is significant, not only more broadly for the province, but for each and every individual that works in the uranium mining industry, or more broadly the mining industry in the province. And I would say is of particular impact to those northern and indigenous residents, of which Cameco itself is 48 to 52% of their workforce. And so that would be the first impact. The second impact, I would say, is more broadly across Canada. And that is the commitment by both Prime Ministers to conclude the CEPA negotiations, the Comprehensive Economic Partnership Agreement negotiations, this calendar year. Access to a 1.4 billion person market for us in this province that produces commodities and makes them available to over 160 countries around the world is good news. For us in this province that currently have 5 significant mining projects that are underway or finding their way through the regulatory process, I'd say that's really a significant market for us to access. From this province that exports about $20 billion of agri-food products each and every year, it's a benefit for so many in this province to have access to that market, not just the farmers, but the people that work at the canola crush facilities, the protein fractionation facilities, whatever that might be in our food production or ingredient system. Second, on agriculture, there was an agreement between the University of Saskatchewan and I think it was NIFTM, which is a pulse protein center of excellence that will be set up in India, again, to provide from the Indian perspective nutritional security for students, for pregnant mothers, and for lactating mothers, which is a significant sector of the Indian population that today is not receiving nutritional security or enough protein in their daily diet. To have access to that partnership, many of the products that flow through that particular program and that as it gets up and running many of those pulses are going to come from this province as well. And it is literally a program that has the potential to feed hundreds of millions of meals to people in India a day. And so those are just a couple of examples of some initiatives, I think, that show real success to the trade mission we're on. In addition to that, advancing deeper, not only the Saskatchewan-India trade relations, which has largely been the focus the last number of years, because the Canada-India trade relationship has not been very strong. That's changing. And the tone in the room, in the meeting between the prime ministers, of which I attended, was very much not only focused on bringing that trade relationship closer, but actually in a very tangible and thought-out manner what the next steps to advancing that trade relationship are.
Second question, what more could be coming in terms of agricultural tariff reductions or elimination?
Yeah, we talked, we met with, I believe, 5 various ministers of the Modi government in India, subsequent to the Prime Minister's meeting that we attended as well, and then some time in Mumbai as well, over the weekend with the business communities. The tariff discussion is a difficult one due to some spread between the domestic and international prices, but we're hopeful that we'll be able to find our way to a resolution to the tariff on peas at the very least, which is 30%, or lentils, which is 10%, maybe by summertime.
Mr. Cockrill,
Quickly, 6 weeks ago, your government announced an independent review into the Safety Act hospitals and the healthcare system. What progress has been made on that?
Well, I'd say the first step of progress, as we talked about, was really around the installation of the metal detectors in facilities. And I know you're asking about the review, but I think it all is really encompassing in terms of just a larger security presence in our hospital facilities, again, to make sure that patients feel safe. There has been some further progress made in discussions with the Ministry of Community Safety. You'll see some announcements soon on that in terms of how we're going to work with local partners to further enhance security in hospitals, and we'll have more to say on the review in the coming couple of weeks.
Just wanted to confirm, you said that this is expected to open in the fall of 2027. Is that an adjustment? Because I thought I recalled hearing that it was early 2027.
Yeah, there's a bit of a difference between substantial completion and when patients can walk through the door. So we expect substantial completion of construction in early 2027, patients walking through in fall 2027. As I said, we're working with our partner here at Takakoop Pre-Developments, and obviously Graham is the contractor here, and thanks to Graham for letting all of us invade their space today. So we're behind a day on construction now, Phil, unfortunately, but Graham and ACD have been doing a great job, and if there's an opportunity to get it open sooner for patients, we'll absolutely have that open.
A final question?
I wanted to just ask the Premier about the talks about the Keystone, just talk about reviving the Keystone pipeline, what your reaction is to that.
Surviving?
Reviving.
Oh, reviving. It's good. I mean, when we look in particular today with respect to the uncertainty that we see, in an area of the world where I came back from on Saturday, it's unfortunate that it's not built today. As well as the second pipe, or the second piece of capital infrastructure that would allow us to provide more oil from Saskatchewan and Alberta to the West Coast. There are countries that want to buy that oil today, and because we don't have that infrastructure in place, because we have been having this conversation across Canada about whether or not we should build it, is really a travesty. And I think will be, one of the, history is not going to look fondly on some of the decisions that our federal government held up over the course of the past decade. I would say, thankfully, what we see today with a new Prime Minister is a very different conversation about how can we provide the entirety of our resources across Canada, from coast to coast to coast, to countries around the world that want to do business with Canada. And there is a lineup of countries today that want to do business in Canada when we see essentially a president of the United States that is resetting trade relations with so many countries all at the same time. That's been evident in my most recent travels to these countries. And I would say, with respect to what I think is now called the South Bow project, or the expanding the TMX capacity to the West Coast, or the project that Premier Smith has initiated and is working on, and we're supportive of a second infrastructure project going to the West Coast. It can't be soon enough. And because we must remember this at the end of the day, is the most sustainable product that you can buy when it comes to the product that is produced, and I'll speak at least to Saskatchewan, from Saskatchewan's perspective. But the oil that's being produced through the thermal projects between the Battlefords and Lloydminster has reduced their methane content by 65% since 2015. Name me an industry that has carbon numbers like that. It is the most sustainable product that you can find on Earth, and we're doing the world a real disservice by not making it available to them. Thankfully, that conversation is changing, and we can and we should move quickly to provide that product in addition to more uranium, more potash, more of the products that we're mining in this province to those countries as well.